good afternoon, everyone. This is Sean Kennedy from the Massachusetts eHealth Institute, and welcome to our webinar entitled Insights into Massachusetts Department of Public Health Registries and Submitting via the HIway. Thank you for joining us for our lunchtime series, and we've got a couple great speakers that are going to share their stories with you. Before we get started, though, I'd like to briefly remind everyone or share with everyone who MeHI is. Again, we're a quasi-state agency. We are under the Mass Technology Collaborative along with our two other sister agencies, Massachusetts Broadband Institute and the Innovation Institute. The Mass Tech Collaborative is a public economic development agency, and MeHI is the state designated entity for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technologies, promoting health IT to improve safety, quality, and efficiency of healthcare in Massachusetts, and advancing the dissemination of electronic health records in all healthcare provider settings. So our objectives today, so the things we'd like you to be able to walk away with, are to be able to describe the steps to connect to and submit public health data via the Mass HIway. And we'd like you to be able to list the various DPH programs that accept data through the HIway. We'll accomplish those objectives by following this brief agenda. We're going to start off with a review of the steps to connect to the HIway and an overview of the various DPH programs, and then we'll open it up to questions and discussion. I'd invite each of you to submit your questions as we go throughout the webinar in the questions area of the GoToMeeting. You can just enter those there. We'll collect those, and at the end of the webinar, we'll go ahead and answer those questions. So with us today, again, my name is Sean Kennedy. I'm the Director of Health Information Exchange here at the Massachusetts eHealth Institute. We also are privileged to have Ryan Thomas, who's a Service Manager at Mass HIway Operations, and we have Sita Smith, who is a Health Information Coordinator for the Bureau of Infectious Diseases at the Mass Department of Public Health. So with that, I'd like to go ahead and introduce Ryan to go ahead and share what he knows about the Mass HIway relative to the DPH registry.
What I'd like to do is give a brief overview as we go through the onboarding process and the submission process as to what a health information exchange is. First, it's defined as a network enabling the secure electronic transfer of patient information across the care continuum. The goals of a health information exchange are to improve clinical decision-making, avoid readmission and medical errors, increase patient engagement, and enhance communication among the healthcare team. Some of the benefits that we see with health information exchanges are improved operations, reduced administrative costs, and specifically today we'll be talking about the streamlined public health reporting and not having to have your IT team manage 3 to 4 different submission paths to reach the Department of Public Health and supply them with various streams of data. Some of the drivers that we're going to be talking about through today, many of you are very interested in hearing some of the meaningful use information and meaningful use requirements, but there are other drivers to using health information exchanges as well. The Mass HIway Health Information Exchange I want to talk about specifically right now. It allows all healthcare systems statewide, regardless of size or technical capabilities, to securely submit and transact data through the direct secure messaging service on the Mass HIway. One of the unique things about the Mass HIway, which we believe will lead to sustainability long term, is that there is no central data repository. We are strictly a direct secure messaging HIE, where we'll be able to house all the information on the participant side as well as the recipient side, whether that recipient be another provider, whether that recipient be the Department of Public Health. Okay, the HIway allows for communication between not only participants of the Mass HIway and the Department of Public Health, but it also allows for provider-to-provider communication, care coordination, participant to payer, and other use cases on the HIway. Today we're going to be talking specifically about the public health submissions as we go through this, and I'll be touching on different avenues of how we'll onboard specifically and get connected to those registries. So one thing that's unique to the MeHI is our trust fabric. Okay, we take a three-pronged approach as a health information service provider, is that we maintain a trust community comprised of technology, security standards, direct compliant messaging transport, and we're a certificate authority for all of our participants. Okay, what that means to you is that we issue certificates, we maintain addresses, direct addresses. We hear a lot of questions about direct addresses. So we maintain that. We issue the certificates. We're able to renew them. We're able to work with you to make sure that you're able to submit securely across the highway. Another piece to the security and the assurance is our privacy. To become a participant on the highway, you must sign a participation agreement that will go through a rigorous validation. Okay, we go through a rigorous validation as a service to all of our members to assure that all organizations that are submitting on the Mass Highway fall under the category of treatment, payer, or operations. Okay, we make sure that everybody that you're able to transact with and that's able to transact with you is and should be on the Mass Highway, that they have a reason to be transacting that is falling under those categories. So what I want to transition to here is how do we get connected to the Mass Highway? And as you guys have all attended this meeting and you're very interested in public health reporting, I want to talk a little bit about how the Mass Highway will be your avenue to submit required and elective reports to the state. Okay. Currently today, we have the public health nodes on the Mass Highway. We have immunizations, lab reporting, syndromic surveillance, the opioid treatment program, cancer registry, the childhood-led prevention program, and e-referral. You know, we started out with just a few of these, and we've been gradually increasing our nodes on the highway, and we will continue to do so. Okay, so first step in the onboarding process is going to be determining which organizations that you're going to be submitting to, that you're required to submit to, and that you'd like to submit to. Once we have determined that, we're going to move to an enrollment phase. The enrollment phase is that each organization must be a legal covered entity or a business associate. Okay, we will review the policies and the procedures with you, and you can review the rates online as well. Okay, for the submission of, if you're submitting for public health only, okay, we can talk specifically about how we do not, at the Mass Highway, charge for organizations that are submitting for just the Department of Public Health only. As you expand your use cases on the highway, you will fall into one of the tiers in the rate card, and we can discuss a little bit more about that as we move forward. You must complete your participation agreement, and that participation agreement comprises of the agreement itself, the services addendum, the administrator designee form, the delegated administration agreement, the access administrator agreement, the W-9, and then depending on your use case, you might have specific Mass Highway participation agreements required. You can find all these documents available at the below link. So when these slides are made available to you, you'll be able to access those agreements there. Once you've submitted your agreements either to the contact information that we'll provide you later or to your client relationship manager, okay, the three specific connection methods that we have to the Mass Highway are webmail, a LAN device, and a direct connection. Okay, both the LAN device and direct connection are currently enabled for DPH connectivity. Webmail is in development for DPH connectivity. We have identified the increasing demand for webmail clients to be able to submit to the Mass registries, and we have begun development and are in the testing phase for webmail submission to the Department of Public Health. Once we've chose a connection option, we're going to talk a little bit about each of these connection options. So webmail is a There's no hardware or software for our webmail option. It's actually something that we host ourselves, that we can provide you with almost like a Gmail or a Yahoo type secure webmail interface. Okay, it's a non-technical interface for users, and you'll be able to access it through a web browser. You'll have communications functions just like email, and it'll be secure and encrypted with the HIway standards. So some of just the downside of this option versus some of the other options is it is a manual check for received messages when sending and receiving across the HIway. Who do we recommend the webmail option for? We recommend the webmail option for organizations without EHRs, organizations that are working through direct connections but would like to connect sooner than later, organizations that may not have a direct enabled EHR and do not have the capability to, say, drop that file to somewhere on their network. The land option is a black box device that runs an instance of Rhapsody on the device, which can be installed in your data center. It is essentially you can send your public health messages directly to the device, either through one of 4 transport methods, either HTTP interface, directory drop, web services, or FTP interface. And you can send your HL7s, your public health documents to the LAN device. They will get picked up by the LAN device. They will be signed, they will be encrypted, and they will be sent along to the appropriate registry. The LAN device, again, will be installed on your internal network. It is installed behind your firewall. You do not need to poke any holes in your firewall. You will simply allow some ports and IPs for outbound traffic, and then work with your vendor and interface team to and our HIway operations team to determine how the right path is for you to get connected to the LAN device. Okay, we recommend this for participants who regularly send data and are expecting to transmit a lot of messages, and but maybe do not have a dedicated IT staff to manage their infrastructure. It's also we've seen this used widely for larger participants with either an EHR that's not compatible with a direct solution, or organizations that possess many EHRs under their umbrella and want a single node on the HIway. The third option is our direct option. Okay, our direct option is a direct XDR option that interfaces directly with the EHR or other message sending software. So of the 3 options, this one is the one that will see the least user impact. The direct solution will allow organizations to set up their feeds to the Department of Public behind the scenes anytime an immunization is administered, anytime a lab is drawn. That interface can be fed direct registry through SOAP XDR. All right, this is recommended for participants who anticipate sending a lot of data on the mass HIway and have a compatible EHR and dedicated IT team who can connect participant systems to interface with the connection. So just to recap a little bit, the LAN device we would install on site for you in your data center behind your firewall, and we would configure that piece for you, and then you can point your interface to it and begin sending. The direct option, we will provide you with direct certificates for you to be able to install in your certificate store. You will then send a message and sign and encrypt the message intended for the appropriate direct address that we provide you for testing on the mass HIway. So once the connection method is decided upon, what we will do from an ops team perspective is work with you on your provider and organizational directory forms. This allows us to create the certificates. Your certificate is essentially your license to be able to transact on the HIway. It is going to be directly correlated with a domain. Our domains that the HIway is domain transport based. So we do transport with, at direct.sitename.masshiway.net in our production environments, and in our testing environments, we transmit with at direct sitename.masshiway.stage.com. So what we'll do is we will load your provider and organizational information to create the certificate, and we will supply that certificate to you either in the attached to your webmail account, loaded on your LAN device, or we will provide it to you directly for your direct connection. Depending on the choice of connection method, we will provide you with specific information for that connection method. So if you're going with a LAN, we'll provide you with a LAN appliance form. If you're going the XDR route, what we would do is we would ask you for certain information such as your endpoints and work with you through that. Okay. Once we have then generated the certificates, we will provide them to you, and the participants will be given access by our team to send to the DPH test environment for each registry that you intend to send. We will then begin testing. So we will follow testing requirements for each of the registries that you will be trading with or submitting to. Each registry has some slightly different requirements, and we'll get into that a little bit later, around how they'd like to see the data propagated into their test system, whether it be test data first, followed by live data to their test environment, and then eventually migrating that to production. So our testing pattern would be send from your environment to the test environment of the DPH registry. We'll work hand in hand with the folks from DPH to validate that the transport occurred, validate that they're seeing the messages on their side, and then DPH will provide feedback on any changes that are needed with the submission going forward. Then what we do is we send data from your live environment to the DPH test environment, and the purpose of this is that we are focused on making sure that the feed is correct and everything is in the correct formatting, and we then move to production once the approval is given by DPH. We will issue you a production domain for the DPH registry that you'll be submitting to, and the participant can send production transactions on an agreed upon time. So what does this mean for you? For new DPH submitters, how you want to get started is you want to contact your DPH registry contacts for the data you're planning to send. We are going to work through any program-specific guidelines on message content and any additional program-related tasks. You'll contact us, the MeHI, and the contact information is on the upcoming slide. You're going to contact us to begin enrollment and onboarding for the transport portion of the DPH submissions. At the same time, it's important to contact your EHR vendor at the same time to determine their readiness for submission to the desired registry, whether any upgrades are needed on your side, any kind of upgrades, any kind of details that are specific to the vendor that may be helpful in connecting. For current submitters that are submitting on the virtual gateway, participants can continue to submit on the virtual gateway for your MU2 attestation. And as we move forward of moving folks over from the virtual gateway to the HIway, we will review the different connection options and requirements that will vary by program. These requirements will be covered by CDAs in later slides. So just to put up some contact information, if you're ready to get started with the MeHI, please contact us at MeHI@state.mass.us. And the numbers there, and there's also listed the contacts for the MDPH leaders for the respective registries.
So good afternoon, everyone. My name is Sita, and I'm a Health Information Coordinator at the Bureau of Infectious Diseases at the Department of Public Health here in Massachusetts. And the reason I'm speaking to this is there, as you know, 5 major components of meaningful use that public health agencies are expected to participate in. And I actually have responsibility from the MDPH side for 3 of those. I routinely put this slide in just so that anyone who doesn't know about meaningful use has the background. I'm sure that this audience does, but I'm sure also that Ryan went through the background to meaningful use and why we're all engaged in this. I want to focus on this from, as Ryan said, the programmatic perspective and the responsibilities of the public health agency. And as you all know, there are these 5 components that as a public health agency we're required to participate in. I'm proud to say that Massachusetts stepped up and said that we were facilitating data submission for all 5, which not all states have done. And as you also probably know, there are immunizations. We have an immunization registry to which eligible providers and hospitals submit data. The syndromic surveillance, which we collect from emergency departments of hospitals only. There are electronic lab reports which come from eligible hospitals, cancer from eligible providers only at this time, and specialized registry also from eligible providers only. And I'll go into a little more detail around that in a minute. We do also have 3 other nodes that are not part of the meaningful use construct at the moment. I personally find these initiatives very exciting, and I think they are actually very good examples of how data can be transmitted through the HIway from user to provider and back again, and I will touch on them if I have time. We all know what the aspiration of the HIway is. It's about facilitation of the electronic reporting of health information. It's about minimizing administrative challenges. It's about helping people test to meaningful use. It's about assuring fast, secure, consistent data communication. And I'd like to step into the actual 5 nodes that we're using for meaningful use, beginning with the immunization system. There's a before and an after picture here. And as you can see, in fact, we were collecting immunization data for the registry before the HIway. And we're continuing to collect it, except now it's going through the Health Information Exchange. So the pathway is very similar, as you can see. But using the HIway presumably offers all of the benefits that Ryan was describing earlier on. If you're a hospital and you're submitting data, it absolutely makes sense to be able to send all your data through a single pipe to the state as opposed to using multiple methods of communication. Just to give you an indication of the scale, there are 7 organizations actively submitting data right now, 10 are testing, and the program tells me that there's anything up to 100 organizations that are still to connect, of which perhaps 65% are large enough in terms of the population they serve to be eligible for meaningful use funding. The node on the HIway is actually in production. The challenges as we speak are that vendors, and you'll see I have a challenges next steps slide for every single one of the nodes, and the challenges are similar across the board. It's about vendors, data providers having different EHRs and trying to make them consistently meet the requirements of the HIway. So there has been, as Ryan will attest, a lot of work being done on trying to standardize these interfaces. The next steps for immunization are, that they will continue working with vendors. They supply solutions, they facilitate solutions as much as they can. And the other thing is talk to data providers, which is something all the programs do, as well as the HIway, to offer guidance on how to attest for meaningful use. Because certainly my experience is that the documentation has not been clear, and we do get a lot of questions. Syndromic surveillance, we never did collect before meaningful use required it. It's new to us. We had, we've decided, the state has decided that we will limit syndromic surveillance data collection to hospital emergency departments only. It will all come through the HIway, and it goes to BioSense, which is a data repository that's sponsored by the CDC and sits in the Amazon cloud. We have not got any data providers in production as yet, so it's very difficult for me to make a judgment on how successful this is or how effective the data collection is. But I would say that if I'd spoken to you a week from today, we'd probably have had 3 or 4 hospitals in production, because it's moving very fast with syndromic surveillance, and I think we're really on the verge of beginning to get good data in. Again, the benefit of the HIway is that it offers a single method. And in terms of scale, we have potentially 70 eligible hospital emergency departments. 52 have registered their intent to supply syndromic data, and 36 are testing. Now, we do have non-hospital providers calling all the time and wanting to submit syndromic data, but really they are excluded from this because the state has declared that it's from emergency departments only. And my understanding is that BioSense only holds data from hospital emergency departments, and because we're using BioSense, that's what we're limited to. The challenges have been very similar in terms of trying to finalize linkages between the different systems. We have made it possible for those hospitals that are waiting to submit data to still attest to meaningful use stage 2, and I'll come to that a little later. Electronic lab reports, again, we've been collecting, in Massachusetts, we've been collecting ELR for a very long time. And 71 of our 73 eligible hospitals already successfully submit electronic lab reports to us. So the before picture, they send ELR to our health information portal, and it's working very well. We've actually had our health information portal certified for meaningful use as well. So we go the extra mile and offer coverage to all hospitals for meaningful use stage 2. The HIway offers an effective alternative way of submitting data. Certainly there's one hospital using the HIway to submit ELR, and at the moment we are offering hospitals the option of using either methodology, because we think it's nice that they have the choice. But as Ryan says, there is a certain amount of discussion about how we can consolidate this. And certainly if you're a hospital, again, and sending multiple data sets to multiple places, it makes sense to consolidate those. So using the HIway potentially does rationalize maintenance and transmission of data. Just in terms of the HIway node for electronic lab reporting is in production, and Beth Israel Deaconess Hospital uses it successfully. We've had not too many challenges with ELR precisely because we've been doing it for such a long time. The cancer registry is really interesting because cancer has been collecting registry data reports from hospitals for a very long time. I spoke to the cancer program, and if you look at this box on the front, in 2011 they had approximately 60,000 reports. But The 6,000 non-hospital reports are the ones that they find extremely difficult to get a handle on. And this is where something like the HIway comes into its own, because there have been methods and ways for hospitals, big organizations, to transmit data in the past. But it's been extremely difficult to collect data from non-hospital providers, primary care providers, other clinics that send through cancer reporting. And if you look at the before picture, they send the information in all sorts of different formats. There's a lot of manual intervention and pre-processing, and as a statistician and an informatician, I can tell you that every time someone touches the data, that's scope for error. So it really has been an unsatisfactory solution in terms of getting data from non-hospital providers, and use of the HIway actually can fix that. And I believe the Cancer Registry is very excited about this because everything gets simplified. So you have your eligible providers who get onboarded onto the HIway. The data comes through the HIway pipe and to the appropriate place in the Cancer Registry, and there's minimal intervention. So in this instance, certainly the HIway offers a solution that wasn't there before. I know, I think I've just addressed this slide. I know that there's one very large provider who is working with the HIway team right now to onboard. I believe the HIway node is actually live and functioning, and so they're just waiting for the provider to make whatever changes are necessary to start sending data. The specialized registry is the one MDPH component for meaningful use that at the moment does not use the HIway at all. We have declared our infectious diseases surveillance system, MAIDEN, to be a specialized registry, and we collect electronic medical records for certain diseases, for hepatitis, for TB, and for sexually transmitted diseases into our surveillance system. And I know we get, I told you already that we already get electronic lab reports, but the EMR actually offers us pregnancy data, treatment data, ICD-9 and 10 codes. So it enhances the data that we've got, and it's really very helpful in terms of triaging for programs to work out which patients they need to focus on first. We have actually 2 organizations currently submitting EHR data. It's technically a little complicated in that you have to have algorithms that can go into your EMR system and identify which cases you want to extract data from, and then format them into the appropriate format and send them through to us. But if anyone wants to discuss this with me, I'll have contact details at the end of this presentation. So the other thing I did want to address is that a lot of folks have been very concerned about the fact that they're not actually able to send production data to us, and how do they attest to meaningful use. But if you look at the meaningful use requirements for stage 2, there are multiple ways in which you can reasonably attest. So you could have achieved ongoing submission, or you could be actively engaged in testing and validation. That is good for attestation too. Or if the public health agency has a long queue of folk waiting to onboard, you just need a letter from the agency saying that you're in the queue. So all that meaningful use tool requires is that level of engagement. So I just briefly want to touch on these other initiatives, which I personally think are very exciting. They're not part of the meaningful use family yet, but I think they really are the essence of what meaningful use of health information is about. The first one is IEATS, which is about collecting information about clients in opioid treatment services. So again, if you see the before picture, it's really very complicated. Data sent through email, there's manual uploading, there's SQL processing, and if you look at the after picture, it's really straightforward for providers to send data very securely through the HIway. And these are non-traditional data providers, if you like, and it absolutely makes something that was very difficult before feasible now. I know this is actively happening. I think that the node is live in production. There are 7 abuse treatment organizations representing 45 services that are eligible to do this. There are 3 vendors who are engaged with the HIway, and there have been challenges, I think, for vendors to connect with the HIway, but it's on its way. The same challenges. It's about getting different systems in sync with each other. And the next steps are to onboard the vendors onto the HIway. The Childhood-Led Poisoning Prevention Program, again, I think this is a brilliant illustration, and I can say that because I didn't make it, of all the multiple formats and ways in which lead data comes into their database and how much more simplified it can potentially be. I think this is exactly what health information exchanges should be about. There are approximately 60 providers, just to give you a sense of scale, and I think Ryan will have more of an update than I do on this, but the node for childhood-led data is in progress right now. There's no provider sending data as yet, but it's work is being done on this as we speak. And the final node that I wanted to talk about was about e-referrals, and that's exchanging data from healthcare provider organizations to community-based organizations. So this totally bypasses the state. So it's really about organizations out in the community sending data to each other. And again, I think this is a very clever notion, and I'm very excited to see how it works. And if you want an example of the types of health provider organizations we're talking about, it's things like the YMCA or the Tobacco Quit Line, working together with community-based organizations. And these are people who currently use paper or, mail or faxes. And if they're going to be able to send data securely to each other, back and forth, I think that's going to be amazing. So in terms of health information technology and the health information exchange, I hope that I've made it clear that this is, in a way, the future and where the future lies. I think if you've seen the slides and from your own experience, you'll know that there have been challenges. I would stress that these challenges apply to all states and all the HIEs. A lot of it is to do with the different legacy systems that are already in place, and with the trust issues that Ryan touched on earlier. But I absolutely do think that when they get bedded in and they start working, they will enhance, improve our ability to do what we do better at a reduced cost. So it's really about, for us, it's not just about meeting meaningful use 2 requirements, it's about increasing the utility of the data we collect to improve public health. We do have a very brief page on the web, and I'll put the address in here. What it does do is it gives you the phone numbers and the email addresses of people you can contact for each of the 5 meaningful use programs. And I didn't give you too much detail about the technicalities here, but if you call in, we'll be able to provide you with what you need.